Daytime Doctor TV is about to change. The days of traditional dental thinking are over. We're here for dental consumers who are tired of crowns, tired of repeated invasive procedures and dealing with problems in their mouth that seem to never go away. There is a better way. There is an alternative approach leading to whole mouth and whole body health for the rest of your life. Stay tuned to learn more now. This is the Dr. Shoup Show. Here's your host, Dr. Randy Shoup.
Hello, everybody, and welcome to the Dr. Shoup Show. I am your host, Dr. Randy Shoup, and when I'm not in my office at Microscope Dentistry by Shoup right here in central Indiana, I have the honor of traveling the globe teaching other dentists these ultra-conservative dental techniques that I use every day. You see, dental schools have been teaching roughly the same systems and the same processes for over 150 years. There is a new way and a better way to give you the dentistry that you want. You know, on this program, we're going to bring you a parade of really exciting guests and really interesting people giving you information that you will never find anywhere else. And today is no exception in that we're going to bring to you Dr. Susan Maples. Dr. Susan Maples is an accomplished dentist. She is an author. She is an educator. She is a philanthropist, and she is absolutely one of the biggest advocates for you, the patient, getting all of the care that you possibly can. And today, we're going to talk about a couple of chapters out of her book that pertain to the #1 sexually transmitted disease in America. You may ask yourself, what on earth is a dental show doing talking about a sexually transmitted disease? I'll tell you that it occurs in the oral cavity, and Dr. Maples is going to share with you the statistics surrounding this literal epidemic that you probably are not aware of. Once we start telling you what this is and where this infection comes from, it will ring true, and you will understand why this is something that you and your dentist need to have a conversation about every visit that you make. So, when we get back from break, we're going to have Dr. Susan Maples talking about the #1 sexually transmitted disease in the United States. Well, we are back, and I have with me Dr. Susan Maples, and Dr. Susan Maples is coming to us from Holt, Michigan, where it is actually snowing. And so, Susan, it's so good to have you here. Thank you very much.
Thank you, my friend. Good to see you, Randy.
Good to see you, too. We have known each other for a long time, and we were just at a really large conference where we both were presenters and speakers in Las Vegas, and it brings us really to the topic that we're going to talk about today. You know, you have been really a leader in dentistry. You have developed some pretty unique ways of practicing. How did your passion begin for the oral systemic health connection, for making dentistry significantly more of a health resource for your patients than simply being a dental office? How did that journey go for you?
Well, I think I was born a bit of a disruptor to begin with, and I didn't really like watching the decline of Americans' health under my watch. I felt like over decades I was watching my patients get sicker and more depressed and more overweight and more insulin dependent and more heart disease, and I was frustrated by that. I felt like I could have done anything with my career, and I picked healthcare, and to watch that American slide on my watch was really hard for me.
Well, you've transformed your practice into so much more than a dental office. You are an author. You have written a very popular book called Blabbermouth 77 Secrets. Only your mouth can tell you to live a healthier, happier, and sexier life. We're going to put a picture of your book up on the screen behind us here. And I'm sure in any book there are chapters that are much more popular than others. What would you say are the top 2 most popular chapters in your book?
It seems like whenever one calls me for a radio interview or a TV interview, they always want to ask about the sex section. Of course, sex sells. This book was written for the public to help nudge or to inspire the public to nudge their dentist to do a little more, offer a little more in terms of total health. And I think the sex section gets people's attention. So oftentimes people will bring up the section called floss or be flaccid, the links between periodontal disease and erectile dysfunction, or maybe the one on HPV and oral cancer called oral cancer from love and other drugs. So those two are probably ones that catch people's attention a little more than the others.
I'm so glad that we're here, we're talking about this, because 99% of most of the people out there who go to the dentist don't make any correlation, don't make any connection between the fact that so many of their body functions are related to what you just talked about. The periodontal disease, the bacterial infection that gets underneath people's gums that erodes away the bones around their teeth. And those bacteria and that infection gets into their bloodstream and causes so many problems downstream. You and I have both been trained by Bale and Doneen in their preceptorship, and we know how heart disease and the risk of stroke and how diabetes, and now even the data is coming forward in terms of dementia and Alzheimer's, all being a significantly triggered and clearly associated event with this bacterial infection. And so in your book you write things that certainly piques the lay public's interest in terms of, these things affect erectile dysfunction via heart disease and blood pressure and the health of the vascular system. But we're going to talk about today something that I think is just incredibly important, and that is the second thing you mentioned, human papillomavirus. Tell the viewers who don't know what HPV is, human papillomavirus, explain that to them. Why is that so important?
Well, let me back up just a moment. As you mentioned, arterial disease, a lot of the public has sort of gotten the message that gum disease from a bacterial source is linked to or causative of arterial disease. And that's what we call the oral systemic connection. My sort of pet peeve is that we call it the oral systemic connection when there are so many connections beyond bacteria. HPV is a virus, for instance, but we also suffer from food sensitivities and insulin, metabolic disease, and how that shows up in the mouth, insulin resistance, prediabetes, diabetes, and the list goes on. HPV has nothing to do with bacteria. It's a virus. So it's not a fungus, it's not bacteria, it is a virus, and it is our most common sexually transmitted virus in the US. If you were to take Scotch tape, Randy, and put it on the back of your arm, or anyone in your studio right now, you'd pull it up with HPV. It is pervasive, right? It's everywhere. So this sort of permeates the background. By the way, we have more bugs living on us and in us than human cells by a factor of 10. So I like to think we look sort of like Linus and the Snoopies walking around with our little microbiome around us, and our skin, in our gut, in our vaginal canal, in our mouth for sure. And this particular virus has 200 strains that we've identified. So some of those make warts on your fingers and toes that are not cancerous. But many of them, 51 of them have been found in our mouth. 25 have been linked to oral cancer. But the new HPV vaccine, the new one that came out about a year ago, that covers 9 cancer-related strains, we call those oncogenic strains, that were designed originally to help with cervical cancer. 73% of the oral pharyngeal cancers are knocked out by that vaccine. So there's another problem with that message, and I'll go into that in a little bit. But basically, oral pharyngeal cancer has outpaced and outnumbered cervical cancer. There are a third more oral pharyngeal cancers than cervical cancers, all linked to HPV, and increasing at 30% a year. So that's considered an epidemic.
Wow. Well, let's kind of begin in the beginning here a little bit, and I think it would be helpful for us to walk through and help break this down for the listeners and going through a stepwise process. HPV, the human papillomavirus, most all of us have heard about it for women's health. We've heard about it in terms of cervical cancer. And so the connection between that and the oral cancer connection obviously is one that is all based on sexually transmitted infections. But let's talk about how common is this? How prevalent is it in society? And we're going to put up a graphic that you've supplied to us that shows how many people in the United States come down with the human papillomavirus infections each year. Those are large numbers, and they're growing, aren't they?
Growing by 30% a year. It's really, we have to get the message out that oral sex isn't safe sex. We also need to make sure, no matter how you feel about vaccines, we aren't going to de-escalate this awful trend until we get the majority of our young people vaccinated. Unfortunately, the FDA has not allowed Merck, the manufacturer, to name oropharyngeal cancer in the um, advertisements. So while you might see an advertisement showing a man saying, "Gosh, I never knew I could get it," you really need to understand that 82% of these oropharyngeal cancers are in men. 82%. So only 18% in women. So this is and by 2020, we'll have more middle-aged men with oropharyngeal cancer than all women with cervical cancer. So this is sort of out of control. 50% of new cases are between the ages of 15 and 24 years old. So this is a time when promiscuous sex is occurring for many young people. And it's a time when their host immune response is low. They're off in college, they're partying like rock stars, they're not sleeping. You know, it's the time when kids go off to college and get mononucleosis. That's a disease that's sort of pernicious and preys on these kids that have this low host immune response. And while we all can be exposed to this kind of virus, this is one of those viruses that you can actually clear. There are some that you don't. For instance, you know, the old joke, what's the difference between marriage and herpes? Herpes lasts forever. Well,
Sure.
HPV doesn't necessarily last forever. We can clear it if we treat our bodies like a temple. If we're clearing a virus like we would clear a flu virus or a cold virus, what do? You sort of rest and you drink plenty of fluids and you stop partying and you do the things that put all of your cells back into repair mode. So while it's possible to clear this vaccine, unfortunately, um, the vaccine, I'm sorry, while it's possible to clear this virus, sometimes the virus roots into the cells and starts to replicate and then ultimately creates a cancerous lesion. And while the cancerous lesion is in your mouth, you can't see it. Only 30% of the cancers we see are not HPV related in the mouth. So while you might notice that your dentist or hygienist is taking your tongue out and pulling it side to side, I hope they're doing that, to look for oral cancers on the side of the tongue or the floor of the mouth, which, by the way, used to be the number one most common place we'd find those. Now, most of these cancers, 70%, are hiding in areas we can't see. Base of the tongue, back of the throat, all around the tonsillar pillars, places that we can't see it. So how do you know you have it? Well, you get a lump in your throat and all of a sudden you're sort of like, that's weird. Or, you know, it gets a little sore to swallow or something like that, and you maybe blow it off for a little bit. By the time it's detected, it's often metastatic because it's in this sort of mediastinal area where there are lots of lymph nodes that
Sure.
carry the cancer cells to other parts of your body.
Yeah. Well, let's take a break right now. And when we come
Okay.
back, I think what we're going to need to do is let's help our viewers understand how they can make sure their dentist is doing the things that their dentist needs to do to look after them and take care of their health, and what they can do to detect this human papillomavirus if it begins to have a lesion on your throat or back in the back of your tongue. We'll do all of those things right after this. And we are back, and we have Dr. Susan Maples with us, and she and I are discussing the number one most common, most frightening, damaging, sexually transmitted disease in the United States right now, and that's the human papillomavirus. And it rears its ugly head. It shows itself in the back of the throat, back of the tongue, on you and I, on our people, and it is so hard to detect. So Susan, what I'd like to talk about right now is that back in the olden days, when we had what was called squamous cell carcinoma, and that was associated with folks that drank too much, that smoked too many cigarettes. And those cancers were very, very easy to detect because they would present themselves on the sides of the tongue, down in the floor of the mouth, where it's right behind people's lower front teeth. It would present itself out on your cheeks. It was really easy to see, and it was easy for us to identify fairly early. The human papillomavirus, though, is an entirely different critter in that it likes to hide way back in the back of the throat. Talk about that, and talk about how difficult it is for dentists to identify it if they're doing just a routine exam. And then also talk about what technical methodologies are there, what illumination systems exist that dentists can use to give themselves a better chance of finding this human papillomavirus cancer.
Well, you bring up a great point. Early detection of cancer is the most critical element. And yes, smokers and drinkers are more prone to even HPV infection, and cannabis smokers as well. But this is a particular cancer that doesn't care whether you smoke or drink. It'll find you, no matter what. And unfortunately, the average onset of first oral sex, Randy, is 10 to 13 years old. So one of the things that we need to do is spread the news that oral sex is not casual, safe sex among children. And then we need to make sure we get our kids vaccinated. I want to make sure we talk a little bit about that, because I don't know that physicians are. And then here's a frustration I have with our profession, you and I, is that if you ask the average dentist what's the #1 cause of oral cancer, they might still say smoking. And smoking is down to about 17%. So it is not the most common cause. This is, and it is hiding, as you say. So while the hygienist or the dentist might be telling you they're looking for oral cancer, we always take the opportunity to say, by the way, most of the oral cancer that we find these days is not detectable by looking with our eyes. It's in the back of the throat. So pay attention. Now, given the fact that 60% of our population have some reflux from either sleep apnea or food sensitivities, many people have back of the throat symptoms, lump in their throat or difficulty swallowing or postnasal drip that they might blow off. The acid on the pharynx increases the likelihood of penetration of HPV. So now it gets a little complicated. But there is a test. And you ask, can we illuminate this? We can illuminate with special lights the cancers we might see in the mouth, early detection, but not in the back of the throat, because if they're not visible, you can't do that. So there is a test where you can just swish a little sterile saline solution, spit into a cup, and in a few days, we can identify through a laboratory what strains of HPV are there, and if these are among those 25 cancer-causing HPVs. If they're there, it doesn't mean you're going to get cancer. It's the persistent infection over time. So oftentimes we're testing our patients 12 to 18 months. In our office, we offered the test to 100% of our patients in a big HPV awareness campaign we did. 25% of the people who chose to take the test, the reason 25% because they had to pay for the test, but the 25% were positive. So now it's been a year and we're retesting those people to see if these same strains are persistent.
Well, one of the things that you mentioned earlier that is, I think, of critical importance is that if you are up and walking and living in our society today, the likelihood of you having the HPV virus either on your skin or in your mouth or in your throat is highly, highly likely. Our disconnect and our problem comes in is that if one of those particular strains that we know is very pathologic exists of all the 200 strains, and then the second thing is how do we know when if any of these viruses actually take hold and embed themselves in the tissue and then become a human papillomavirus cancer back in there. And you mentioned it earlier, and I think it's really important that we touch on this and spend a little more time. The biggest and most common presentation of the human papillomavirus cancer back in the back of the throat is for people to have a very light, very mild, symptom that they can write off, that they can explain a zillion other
For sure.
ways. Okay, I've got a little tickle in my throat. I've got a little bit,
Throat clearing.
yeah. And one of the things that people will do is they'll pick up this habit of clearing their throat. Or I have, one of the big things is I have sinus drainage. Talk about the things that people experience that they write off as something benign, and it very well could be one of the early symptoms of the human papillomavirus cancer in their throat.
Well, and you have to, if you're going to look at that, you have to look at all of the throat clearing, the postnasal drip, the reflux, the chronic cough, all of those things that are also associated with food sensitivities. Our food's kind of a mess if you haven't noticed, and so many people are irping food up instead of down the way it's supposed to go. So if 60% of people have occasional reflux and half of them have reflux regularly, we're talking not just about heartburn, but all those silent symptoms we just talked about, they look kind of like the same symptoms you might get from an oropharyngeal cancer. And people do often feel like they have a lump in their throat, and it's related to this, incidence. All of that, along with smoking and alcohol, increase the incidence of HPV taking hold. The big question is, would it be helpful for us to have a test to know if we are HPV positive? Well, look at women's cervical cancer. They do a pap smear, they test for HPV. If you're HPV positive, you need your pap smear yearly to be looking for cells that change. So we're able to actually do that. Now, if you're HPV positive here, there isn't a protocol to say, gosh, I should go to the ENT and have that little tiny scope to be looking around for lesions. But certainly you need to be your own advocate. If you knew you were HPV positive, and by the way, there is research that I sent you in one of those slides that shows that survival rates are increased when we're aware we're HPV positive. Why? Because we're more alerted to early signs and symptoms.
Sure.
You would be a little more cautious, right? Mm-hmm. So you don't want to make people paranoid, but you certainly want to focus on how can we detect this earlier in a place where we don't get to look. There isn't a pap test that we're doing here. You actually have to ask someone to look in your throat.
Sure. Now, let's, in the few moments that we have left, let's really get into the vaccinations. I know there's somewhat a controversy about the vaccine, but this vaccine for the human papillomavirus, tell the people about the vaccine and tell them about how effective it is. It is pretty remarkable in the vaccine world how well this one works.
Yes, it is. You know, we always wonder with the flu vaccine is you say, oh, someone got the flu. Why did I bother to get the vaccine? Well, if you knew the vaccine could knock out your chances by 73%, I mean, that's pretty good odds that you're going to help a young person or any of us even our age to try to avoid this. Now, the vaccine originally had 4 strains and now it has 9. So it's the 9 most common. And if you get all 9 of those vaccinations, you get those strains, you get 73% protection from cancer. So we were vaccinating girls up to 26 and boys to 21 because originally we just thought boys are the carrier. While they did get penile and anal cancers, most of the cancers were in the vagina and on the cervix. Now with oropharyngeal cancer, and by the way, white males are more likely to have HPV oral cancer than any other segment, thought to be more oral sexual partners and earlier oral sex. But the fact is,
so let me jump in. So at what age is a boy or girl eligible for this vaccine?
11 or 12 years old is the target.
If you have a boy or girl 11 or 12 years old, that's when they begin to be eligible. And for how long? If I'm 40 or 45 years old, am I still eligible?
Yeah, so just as of October 9th, it goes up to 45. It was up until a month ago. It was a month and a half ago. It was actually up to age 21 in girls, 26 in boys, or the other way around, 26 in girls and 21 in boys. And because so many of our kids missed it, in fact, this year is the highest we've ever vaccinated, and we got to 50% initiated, which means it takes more than 1 dose. So just because you gave them 1 doesn't mean they follow through. So this is tricky too. And if you're older, if you're college age, you need 3, not 2. So we're really looking at a generation of kids that we missed. And so we're going to see this disease escalate and escalate, and we're all going to lose people we love. There's no question.
Wow.
Until we start to see this taper off, when we get enough of these kids, young people, a young generation of people that gets immune to it.
Sure. Well, Dr. Susan Maples, I cannot thank you enough for being with me. You have given us an absolute massive amount of information and a massive amount of intelligence that we didn't have before. So thank you very much for sharing this really important message. I really appreciate it. Thank you.
You're welcome, Randy.
All right. I'll see you later. Thank you, Susan.
Okay.
All right.
Bye-bye.
Well, there you have it. You have received information like I promised that you are never going to receive anywhere else. And I want you to know, I want you to be here every week on TV 40, where you will see absolutely revolutionary information from experts from around the country. So until you and I have a chance to chat next time, be sure to brush and floss.